On the record, we are joined today by Dr. Ambarish Sathwik, who, apart from being a vascular surgeon, has also writes columns. And recently, he wrote a piece for his neighbors about how to handle COVID-19. But it struck a chord. Like a lot of things do on WhatsApp, it spread far and wide and has struck a chord with many because it talks about just how serious it is and how careful we all should be. Dr. Sathwik, thank you so much for speaking with Hindustan Times. I should point out that as we're speaking right now, you work for a hospital which has become the center of a major fight for the Delhi government. You work for Sir Gangaram Hospital, and as we speak, your hospital, even though it's a COVID-19 hospital, has been barred from doing any COVID tests and also now is at the center of a criminal investigation. They filed an FIR against you. Now, as someone who works there, Dr. Sathwik, can you tell us what that's like?
If you were to evaluate why the FIR has been filed, it's because we were not uploading data onto an RT-PCR app, okay? And which doesn't mean that information was not being passed on. In fact, all the details of the COVID testing that were being carried out in Gangaram Hospital were being entered into an IDSP portal, which is the Integrated Disease Surveillance Portal, and submitted to the Delhi government. In fact, this has been acknowledged by the issuing authority in the FIR and the show cause notice. So it, along with the Aadhaar numbers and the contact numbers of the patient. So it's not a matter of that we're not delinquent in non-transmission of details, and it's not that it was withheld, but just that it wasn't being uploaded onto an app. And I don't know how much of an egregious offense that is, not to upload it onto an app. I'm sure it's highly admirable to have paperless transmission of data, but if it merits an FIR is a completely different matter, and the matter is being contested as we speak. It's this intransigence is creating a lot of problems for us. It's highly injurious. And allow me to point out that there are many labs in the country that are not using the app, okay? But ours is the only hospital which has been, dragged through this in this manner, and an FIR has been filed, which means that there's been a criminal offense committed. So this seems spiteful on the face of it. But what happened is that because we are a designated COVID facility, we are admitting patients and we have no means of testing them. I'll give you an example. Let's say we do a cesarean section in our hospital on a COVID positive patient, okay? And the neonate that is born, the child that's born, has meconium aspiration, has to be taken to the neonatal ICU. Now, currently, we are not even allowed to collect a sample for COVID testing from this infant. And this infant is being then conveyed to the neonatal ICU, perhaps put on a ventilator. You are threatening and jeopardizing the lives of all the neonates who are in the neonatal ICU on account of this. So I think this kind of intransigence, this kind of impedance and intrusion is highly injurious, not just to the hospital, but to the patients who are admitted in the hospital. And I can't see any way out of it unless they immediately decide to restore our COVID testing status.
So this example that you give us, it's actually quite illustrative, but you talk about the kind of danger to other patients and other babies who would be there at the neonatal unit. But I'm assuming that it's also very dangerous for healthcare workers like yourself, because you don't know exactly. So does that mean all of you then look at every patient who comes in there as someone who is COVID positive?
So we've started doing that, but I'll tell you about, as of now, 313 of my colleagues, healthcare workers from Gangaram Hospital, have been affected by COVID. We're working with 313. This includes doctors, nursing staff, technicians, ward boys, sweepers, all our colleagues. 313. 100 of their dependents are infected with COVID.
My God.
We're working with a severely depleted workforce, and most of them were infected when they were tending to asymptomatic patients who were admitted for other reasons. And subsequently, it was found that they're COVID positive, because the incidence of positivity in asymptomatic cases is quite dramatically high in this city right now. So I'm saying that it is, in fact, extremely risky to work in such environment. But more importantly, it's our fundamental responsibility to prevent intramural transmission of infection. What that means is cross-infection. Patients who are admitted for other reasons, perhaps for other medical ailments, for dialysis, for chemotherapy, for surgical procedures, if you don't have any awareness of their COVID status, it's possible that an asymptomatic COVID patient might be admitted there and might end up infecting a whole bunch of others. It's also because designated COVID areas and COVID-free areas have to be structurally separated. There has to be a cordon sanitaire around the COVID areas. There has to be a green room between them where you can don and doff PPEs. So you need to carry out structural and topographic changes in hospitals. You have to break down walls. You have to make sure that air handling units are compatible, COVID compliant. You need at least 12 air circulations in an hour for an area to be COVID compliant. You just can't announce suddenly that, give us 80% of your beds for COVID. There needs to be very careful consideration in these matters and deliberation and consultation with private hospitals to let them know what to expect.
Instead of just ordering them. So your hospital is now a total COVID-19 hospital. Have you been successful in doing that? I mean, is it operating as that?
No, we're not a total COVID-19 hospital. 80% of our beds, we've been asked to convert them to COVID beds. What happens is that Gangaram is a complex of hospitals. There are 3 hospitals that constitute Sir Gangaram Hospital. There's Gangaram Colmer Hospital and Gangaram City Hospital, which are outside the main complex of Gangaram Hospital. And these 2 hospitals were converted into dedicated COVID facilities early on. In fact, we were the first private hospital to start accepting COVID patients very early on in the course of the epidemic. And this is when we gave about 50-odd beds in Gangaram Colmer Hospital and converted that into a COVID facility. Then the government said, no, we require more beds. So we gave about 120 beds from Gangaram City Hospital. So it took us about 15 days to convert City Hospital into a COVID-compliant facility. Subsequent to that, they said, no, we need more beds. So they asked for 20% of beds in the main Gangaram Hospital to be converted into COVID beds. We've done that. And then about 4 days back, there's an order passed at 10 p.m. at night saying, now we want 80% of your beds to be converted to COVID beds. Now, you have to understand that Gangaram is a very busy tertiary referral institute. Okay, pre-COVID times, we were functioning at 140% occupancy. It's a center of excellence. A lot of people come there for a variety of reasons. We're one of the finest physicians and surgeons in Gangaram. We'll be betraying a lot of our patients if we don't have beds for them, for ailments that don't fit under the category of COVID. So this has to be done very carefully. And of course, you have to discuss these things with the management of private hospitals before you start ordering them to convert their facilities into COVID facilities.
So why do you think they're doing this? Is it because of the fact that the numbers are rising in a much faster pace than was previously anticipated, that we are seeing almost 11,000 new cases nationwide, that the number of deaths is also increasing? We're not seeing the peak just yet. We're only going towards the peak. Is it panic stations? That's what's happening?
Yes, I would believe that, but I'm not equipped to answer that. It's clearly for everyone to see where this is headed. And I think, in my opinion, we did not utilize the 60 days, 70 days of lockdown to ramp up state capacity in creating beds. What happened was, I think most government hospitals were just evacuated, patients were sent to other hospitals, and these hospitals were then converted into COVID hospitals. But that's just evacuating patients and creating existing infrastructure into COVID hospitals. You need to create new infrastructure. You need to ramp up capacity. That hasn't happened. And I think in that sense, the lockdown was a complete failure because we didn't really ramp up capacity in a manner that was that should have been anticipated, and which is why you now have these diktats being passed about private hospitals suddenly being asked to dedicate about 80% of their beds to treating COVID patients.